Well, thank you, Mr. Chair and Ranking Member McCaskill. Thanks for being here, Congressman Mulvaney. And I did enjoy our meeting in my office, and you and I found some common ground on the importance of fiscal responsibility. We're both firmly committed to good government. And we agreed on some steps we could take to improve the federal budget process, for instance, biennial budgeting, something we do in my home state of New Hampshire. But I did want to take a minute to reiterate a couple of things that we've touched on here today. I was governor of New Hampshire when the 2013 federal government shutdown occurred. And I can tell you it had a major impact in my state. It shut down facilities in the White Mountain National Forest over Columbus Day weekend, which is the height of our leaf peeping season and one of our biggest tourism weekends of the year. Hundreds of New Hampshire National Guard employees were furloughed. Other furloughs happened at the state level. Not only did that impact those families, but obviously businesses throughout my state were impacted when people don't have their checks, they don't engage in consumer activity. So I would ask you, in light of your earlier comments that have been highlighted here already about the shutdown being good policy, just to understand that when people actually live through it, it's not an abstract concept or idea. It really hurts. It hurt our economy, and it hurt a lot of people. When I furlough National Guard employees, it compromises my state. So do you still really think it was good policy?
I appreciate that, Senator. I appreciate having the chance to talk about it in your office, and I do hear your criticisms of what happened. And let me put it to you this way: I don't believe that shutdown is a strategy. I don't believe that shutdown is desirable. What I do believe is that sometimes it is an unfortunate result of us not being able to agree. People say you voted for the shutdown. That's not true. There was no such thing as a vote for a shutdown. I voted for an appropriations bill that did not pass. So I look forward to being able to encourage the president not to use that as a tool, because it's not an effective tool.
It's not only an ineffective tool, it hurts people. Mm-hmm. And I think our job here is not to just refer to it as unfortunate, but to acknowledge that it impacts real people. I wanted to talk a little bit, too, about the impact and importance of Medicaid, especially to the substance abuse epidemic that my state and many others are facing. Drug overdose deaths now kill more than 50,000 people per year in our country. That's more than other leading causes of death, such as car crashes. My state of New Hampshire has the second highest rate of drug overdose deaths in the country. And as governor, I worked with Republicans in my state, as well as the business community, to expand Medicaid to cover over 50,000 hardworking leaders. Thousands in New Hampshire are now getting coverage for substance use disorder treatment, and experts have said it's an absolutely critical tool for addressing this epidemic. And Medicaid expansion is now under attack from this administration as the administration talks about repealing the Affordable Care Act. And then there's this discussion of block granting Medicaid, which would likely result in a 20 to 30% cut in Medicaid funding to states within just a few years, which has raised concern from Republican as well as Democratic governors. Republican governors like John Kasich, Rick Snyder, and Charlie Baker have been speaking out against block grants and Medicaid cuts that would hurt their states. So you have supported Medicaid cuts such as the ones that are being suggested in the past. So can you agree that substance use experts say that Medicaid's critical for combating the crisis? And don't you think that removing federal assistance for treatment will harm people suffering from substance use disorders?
I can say this, Senator, which is that I know the president talked about those exact same things on the campaign trail. In fact, I think he may have talked about it in your state or certainly in your part of the country, and I know it's important to him. So I see my role, if he sets out the policy. Our policy of the Trump administration is going to be X on opioid abuse. And my goal is to try and figure out a way how to pay for that, how to implement that as efficiently as possible, work with whatever other federal agencies are involved so that we can satisfy and meet the president's policy. You've asked me again, as many people here have today, how I voted in the past. And I defend those votes. Again, I was voting on behalf of the people I represent in South Carolina, but I do see my role changing to an advisor and then an implementer of the presidential policy.
Well, and I thank you for that, and I do appreciate it. I'll just ask you all to consider, as you advised the President, that we have Medicaid expansion in place. In my state, it was a bipartisan plan. It has helped us begin to build the kind of treatment infrastructure we need, and to repeal it and destate it, even if you replace it with something else, seems to me to be less than wise. So I hope you'll take that back. And toward that end, I wanted to touch on one other area that where your new role may be perhaps at odds with past votes. One of the most trusted family planning and reproductive health providers in the country is Planned Parenthood. In your potential role at OMB, the goal is to assess the quality of agency programs and procedures. So I'm troubled with your record that indicates a bias and opposition to programs that impact women's health. Programs like the Title X Family Planning Program help provide essential family planning and preventive health services to women nationwide. As a steward of good government, I believe that when we award grants to organizations, we need to take into account which organizations are best able to provide the services. I think funds should be awarded based on a provider's ability to serve patients and not based on an ideological or politically motivated agenda. Do you agree?
Senator, I do believe that money should be allocated based upon an ability to serve patients. I would point out that the President has said very complimentary things about Planned Parenthood during the campaign, except as it comes to the providing of abortion, where I think he and I there are probably on the same page as to what I have supported in the past. What I might recommend to him in the future is that moving money to the federally qualified health care clinics could be an even more effective way to provide those.
I'm going to interrupt you just because my time's almost
up.
My federally qualified health centers say they can't absorb the thousands of women in New Hampshire who use Planned Parenthood. A lot of those women don't have geographical proximity to those centers. I'll let you know that when I was at Planned Parenthood in New Hampshire, one there just a couple of weeks ago, most of what they do is family planning and reproductive health services for women who can't get their care otherwise. There were women there who, once they got private insurance, still went to Planned Parenthood because they said the care was so superb. And Planned Parenthood also takes care of women during their pregnancies when women want to continue their pregnancies, and do a superb job of that as well. It's a really important resource, and it's a very cost-effective one from all the data. So I hope that we can get to making data-driven decisions around settled law and recognize the importance of this particular provider nationwide to the women of our country. Thank you.
Thank you, Senator.
Thank you very much. And Congressman, thank you for putting up with a long stretch of questions. You've had a long day, and I appreciate that very much. And I just wanted to follow up quickly on a couple of things and then just ask one question. There's been a lot of discussion about reforming Medicaid and flexibility in the program, and should you be confirmed, I'd like to offer to work with you on that, since in my experience as a governor, there's been a lot of flexibility in the Medicaid program. We're going through an 1115 waiver process right now in New Hampshire, which is really allowing us to integrate our behavioral health and primary care in ways that are very promising. And so before kind of throwing the baby out with the bathwater here, you might want to learn from governors who are currently working well with the federal government and finding that the government's willing to be quite flexible to help us meet the needs of our states.
Absolutely welcome the opportunity to do that.
Well, thank you. The question I wanted to ask was on climate change. Earlier today, it's my understanding that you had an exchange with Senator Kaine about climate change. I obviously wasn't there, but my understanding is that you told him that you agreed that climate is changing, but the science on how much impact humans are having is unsettled.
I don't think that's verbatim, but that's a fair recalculation. Okay. Yes, ma'am.
So I'm a little concerned with that because, first of all, OMB director does have a significant role when it comes to climate change. You need to know the science in order to allocate the budget effectively. You need to know the science in order to run the OIRA process effectively. You just had a really good exchange with Senator Portman about the importance of data and evidence-based policymaking. So here's what scientists say they are clear in their understanding of the climate change science. The American Association for the Advancement of Science says the scientific evidence is clear. Global climate change caused by human activities is occurring now, and it is a growing threat to society. The American Geophysical Union said humanity is the major influence on the global climate change observed over the past 50 years. The American Meteorological Society says it is clear from extensive scientific evidence that the dominant cause of the rapid change in climate of the past half-century is human-induced increases in the amount of atmospheric greenhouse gases. The Intergovernmental Panel on Climate Change says warming of the climate system is unequivocal, and human influence on the climate system is clear. So I'd like to understand what you find unclear about this science that these scientists have been so clear about, and why you or I, with our non-scientific backgrounds, would be qualified to disagree with these climate scientists in their area of expertise.
It's fair enough. And again, every time I have a conversation about climate change, I had some very, as you can imagine, colorful conversations with Senator Sanders about this in his office. I try and figure out a way to draw it back to OMB. And the way I do that is by recognizing the fact that OMB may be called upon at some point to give an opinion on some type of regulation regarding carbon, for sake of this discussion. Okay. In my role as OMB director, overseeing the Office of Information and Regulatory Affairs, it would be my job to look at exactly what you just laid out, and also look if there's folks other sides of that opinion, and then try and balance that with things such as the costs related with the regulation. Bearing in mind, in particular, that regulatory costs have been described as some of the most regressive costs that we have. It falls on the poor much more than it does on the rich. So it's a complex dance that the OMB director has to do before giving the president an opinion. Do I bring certain biases to that? Yes. Would you? Certainly. That's what we do. It's the nature of our business. But my job would be to take that information that you just laid out, see if there's other information that may be to the contrary, and try and give the very best summary to the President of the United States as I possibly can.
And I respect that. I would ask you to look at peer review science, not people's criticisms of, not industry-based attempts to mask the science, which we've seen a fair amount of. And in terms of regulatory burden, I've worked as a governor. We've all worked to reduce regulations. But, when you talk about burdens, when we have polluted air, more kids get asthma. When more kids get asthma, especially if they are low income, and especially if we do things like repeal the Affordable Care Act and they can't get access to primary care and health insurance, that costs us money in different ways. There's a reason my business community in New Hampshire supported Medicaid expansion so strongly, because I understand the value of a healthy workforce. When we don't have clean water, that costs us enormously, and it particularly costs low-income families who don't have the budgets to go out and buy bottled water, right? So I just would ask you to think about the balance in terms of regulations, not just with a dollar amount and not just from concerns that I understand. I was a business attorney for 25 years about how hard it can be to navigate regulations when you're running a business and the impact that can have. But there's an impact on families. There's an impact on natural resources. There's an impact on the economy. I can tell you the maple sugarers in New Hampshire feel the impact of climate change, and so does my ski industry. And so it really behooves us to listen to the scientists. The predictions they made about climate change and the impact of human behavior on it decades ago is playing out in front of us. So we might want to really just start listening to them.
Thank you, Senator.